Good afternoon. And today we have a very special guest, my friend, Dr. Anna Morse. Good afternoon, doctor.
Good morning. It's so great to be here. Thank you for having me on.
Absolutely. And thank you very much to our audience. If you have trouble sleeping or sleep next to the snoring partner, this program is going to be for you. And especially if you're concerned about your kids' health, we're going to give you some practical tools. And if you're a medical professional who, just like us, so concerned about lack of sleep or trouble sleeping among your patients, this program is going to be for you, because today we're going to show it to you how two worlds, dental and medical, can collaborate, and what we can do together, and as a team we can create a better sleeping environment for us and for our patients. And now I'm gonna tell you my own story with Dr. Ann Morse. I'll tell you, start from the far. I always admire the energy of Anne from far away. And then we plan to have a podcast together. That's what it is. And then our collaboration in person happened on the conference, American Academy of Sleep Medicine 2024, actually very recently. And I was totally knocked off my feet. But first, I'm a very aesthetic person, and I was, impressed with the elegance and the style, but also with the knowledge and with the passion towards their profession. And in a 24 hours day, Anne can do so many things. And just from the bio, she's a director of pediatric sleep neurology. And, she's going to talk about those accolades herself, because it's just so many of them. But I'm going to tell you what impressed me. She's writing the book on communication in the healthcare. She has podcast, or used to have a podcast, Sleeping Around, which was very practical as well. And now she has a program for kids, and I'm so passionate about that. I was writing the article about the topic, and actually Anne is doing that in the reality in a program called Wake Up and Learn. And we're going to talk about that during our interview as well. That's the practical knowledge what I'm giving to kids, school kids, college students, and residency, in residents, medical residents, how to sleep. What sleep is a skill. It's such a necessary skill. So let me start and last thing. Anne is really popular on TikTok and Instagram, and she is bringing a practical glimpses into her sleep world. Like, we're talking about insurance coverage. We're talking about pharmacology advancement. So I highly recommend you to visit her channel and learn from Anne. But I'm going to start with the question what concerned me. Can you please tell us what are the most common signs parents can look if they suspect what child is struggling with sleep? And I'm not talking about, just a bad sleep. I want you to tell us what's the difference with just, occasional bad sleep, or something parents have to be concerned about.
Sure. So I think that it's really important to recognize that everyone is going to have that occasional period of not necessarily getting the best night's sleep. However, we need to also recognize that those periods of that occasionality where we're not getting that sleep can actually be a provoking factor for that to become a more chronic issue. And so even if you were to reflect on the 3 Ps by the Spielman theory on insomnia, there is the predisposing factors, the provoking factors, and then those perpetuating factors. Now, with that in mind, it is important to recognize that many times people are familiar with what may be the more common things we see in society, or the more common things that you may have heard of because it was on a news channel or in your favorite magazine, or, as you've mentioned, social media. However, it's important to recognize that although you might have heard of things of insomnia or restless leg syndrome or even obstructive sleep apnea, I've only named 3 of over 70 recognized sleep disorders that are outlined in the International Classification of Sleep Disorders, Edition 3. Now, with that stated, it is really very important that when you're looking for signs and symptoms of a sleep problem, that you're not only looking for signs and symptoms at night while the person is sleeping. It is not uncommon that the most common symptoms you're seeing are actually the dissatisfaction or a divergence from what is expected during the day. So when should you be looking at a concern for a sleep disorder or the possibility of sleep being negatively impacted? If you're seeing that a child is excessively sleepy, they used to nap and that stopped napping at 3 years of age, 4 years of age, they're now 6, napping reemerges. That's not normal. You should not be napping during the daytime, especially once your napping goes away. We typically see that daytime napping does go away between ages of 3 and 5. What are some other signs and symptoms? We recognize features like ADHD, both inattentive as well as hyperactive, can truly be just a manifestation of a sleep disorder, but also the diagnosis of ADHD is highly correlated to having a sleep disorder. You can also see irritability, mood swings. You can see deterioration in school performance. You can see risk-taking behavior. The reality is that if there is a concern about your child's overall health, wellness, performance, decision-making, take a look at the sleep, because the sleep may be having a problem. And so instead of trying to recite 70 different sleep disorders, I would make it a very practical approach. Are you concerned about the duration of your child's sleep? Recognizing that the age of the child really is going to give you guidance on how much sleep. 8 is not great. What I mean by that is that everyone has a knee-jerk reaction to saying 8 hours of sleep. When I see a 3-year-old and someone tells me that their child is sleeping great, they get about 8 hours, that already gives me a red flag, because there's a conditioned response to thinking 8 hours is what everyone needs. A 3-year-old is really going to need closer to 10, 11, 12 hours of sleep. Now, it's important to also recognize beyond duration is what is that quality of sleep, just like we talked about quality of wakefulness. What's the quality of sleep? Are we seeing that they're very restless? Are there features of snoring? Are there other abnormalities that either the child is complaining about or observing that is causing to have very fragmented, poor quality sleep? Different spot or, okay.
I would like to ask you, what are most common sleep disorders you see in kids?
Sure. So I think that when looking at the most common sleep disorders that we're just seeing in the United States in general, it's going to be insufficient sleep. And this has been a trend that we've seen since at least 2014. What I mean by that is that the CDC declared the United States in a major public health crisis in 2014. So yes, 10 years ago, because of the number of adults experiencing insufficient sleep. At that time, those statistics were 1 in 5. When you look at the most recent census data around this, it actually is demonstrating that those statistics have only gotten worse. It's now 2/3 of adults are having insufficient sleep. So you would say, are we seeing similar trends in children and adolescents? Unfortunately, yes, we are. We see about 58 to 73% of middle school and high school students are struggling to get the age appropriate duration of sleep, which typically is going to be about that 8 to 10 hours in that age group. And so the majority of people are walking around sleep deprived, and therefore there is a very, very common experience in that. And the challenge when that something becomes so common is people start to mistake that as normal. We see that, oh, you're sleeping 6 hours, I'm sleeping 6 hours. Everyone believes that 6 hours now is normal, and that's normal. That is normal. But the important distinction is common and normal are not the same thing. And when we start adapting that mindset, we start adapting and accepting a lesser version of who we are, as well as living with pathology. Outside of insufficient sleep, other common things that we can see in children are really going to be more around the idea of things like nightmare disorder, parasomnias, most typically non-REM parasomnia. So that's that confusional arousals, the night terrors, the sleepwalking. Although sleep talking is something that we can observe, it actually is considered a normal variant, not necessarily a pathology. However, with that stated, we do see that people who are more likely to sleep talk are also tend to be more likely to have some of these other phenomena. Part of the reason that we see this more commonly in children and adolescents really has to do with the fact that the developmental changes that occur with how we cycle through sleep. We spend more time in our slow wave sleep when we're younger, and that is a period of time that creates more susceptibility to us having a non-REM parasomnia. You throw in the fact that everyone is sleep deprived, and our body naturally rebounds into more slow wave sleep to try and catch up, quote unquote, or repay that sleep debt, and therefore only further increasing the likelihood to see more of these non-REM parasomnias. Although we see things like sleep apnea in pediatrics, the statistics around that is really only about 3 to 5% of children typically have obstructive sleep apnea. Now, with that stated, depending on who you're looking at, what is their medical journey, that risk stratification become much higher. So when you're talking about children of neurodivergence, for instance, so things like autism spectrum, up to a third may actually have obstructive sleep apnea, and sometimes even a complex feature with some central apneas in there as well. So I do think that these are very common conditions. For myself, although I see pediatric sleep medicine in general, I have more of an enriched environment of who I see in regards to a condition like narcolepsy or idiopathic hypersomnia. And although those are not quote unquote common conditions, these conditions are most commonly to develop in the pediatric age group. So it's always a really important thing to call out, because everyone is sleepy, but this degree of pathologic sleep is a condition that you do need to recognize, because this is a chronic medical condition that does require attention and can be very disabling.
I have a question for you, and it's so common with, kids you explained so well, but let's talk about teenagers. That's my favorite group, because not everyone aware of the significant emotional, hormonal shift in that age. And sometimes parents look at this as a disobedience. And on top of that, that serious impact of technology and social media and generational gap get even deeper with that, because some generations think that's not necessary, and teenagers think it's like an air. So what your view on balancing technology, social media, which produce certain light which affect the sleep as well, and shift what teenager experience during the adolescence years, and how parents have to deal with that? What would be the balancing strategy?
Sure. So I think that was some of the things that people may not be familiar with is that there are different processes that direct our sleep and wake. And those processes include something called our circadian rhythm, and then another process called our homeostatic sleep drive. And it's important to understand both of these processes because they interact with one another in order to be able to facilitate, one, what is our normal wake sleep rhythms or our circadian rhythms, but also what is our duration of sleep, as well as the factors of when we're seeing the timing of someone go to sleep. When you look at those younger children before adolescence, we generally are seeing that their bedtimes are going to be earlier in the evening, and they also are requiring a greater duration of sleep. So you may be putting your child who might be 8, 9, 10 years old to sleep at around 7, 8, the latest maybe 9 o'clock. And when you're talking about adolescence, we generally start seeing that they're staying up a bit later, and they may even be staying up to 10, 11 o'clock. And pathologically, we sometimes see that get shifted even further to 1, 2 o'clock, 3 o'clock in the morning. What we're seeing is that there is a biologic delay in the circadian rhythm. And we see that this biologic delay in adolescence actually is conserved across species when you're talking about the transition in ages. Now, although many would say that we don't fully have a great understanding, in 2007, Mary Cascaraden actually had done a great paper that had demonstrated that what we see in adolescence is there actually is a decreased accumulation of our homeostatic sleep drive. So that's the thing that wants to put us to sleep. And the reason that becomes important is because our homeostatic drive can actually manipulate our circadian timings of sleep and wake. And so if it takes more of it takes more for me to accumulate our homeostatic drive, my circadian rhythm is going to be pushed to a delayed phase. So with that stated, we see that although you might have this 7, 8, 9-year-old who falls asleep maybe by 9 o'clock the latest, when you start seeing those teenage years, they're starting to fall asleep and have a natural drive to go to sleep between 10 and 11 o'clock at night. Now, the challenge is that we currently are all living in a FOMO world, the fear of missing out. And so therefore, we want to be connected and stay connected 24/7. And that is further compromised by the idea of I'll sleep when I'm dead because I can get away with less sleep in order to get more done. Unfortunately, that mindset is really the opposite. If you are trying to sleep when you're dead, you're just going to get there a lot sooner. And also you become a lot more inefficient. When we look at the effects of all these technologies, there's a lot of conflicting data around what the deleterious impact of light may be. We see that there are different wavelengths of light, and there even is dynamic spectral lighting that people can utilize in their homes and otherwise. Our cell phones already do this. If you are a person who you're like, why can't I read anything on my cell phone after 6 o'clock because it's so dark? It's because your phone is trying to limit the amount of blue light being emitted from the cell phone. The reason for that is blue light talks to your eye, tells your suprachiasmatic nucleus it's daytime, and then tells your pineal gland do not produce melatonin. The darkness or dim light, and especially when things are more in a red light wavelength, are going to promote the idea that it's time for sleep and it is okay for you to be producing melatonin. So a lot of people have done research looking at, well, when we're on our screens, whether it's television, cell phone, tablet, computer, gaming, whatever it is, how is that negatively impacting our ability to fall and stay asleep? Now, what has been fascinating is that there was a plethora of literature that was providing evidence to suggest that it was the light alone that may have been causing this negative impact. What more recent literature is actually demonstrating is that the light may be playing a role. The content of what we're doing is likely much more substantial in regards to the deleterious impact on our sleep. So let's go through an example. Some of the things that we're currently doing is going to be social media, whether it's Instagram or TikTok. They all are designed the same way. They're designed with very, very habit-forming, addictive behavior strategy. So one of the things that you want to remember is when you're looking on your cell phone and you're scrolling and you're scrolling and you're scrolling, you then will be subject to intermittent reward. Meaning I scroll, I see something funny, I see something engaging, blah, blah, blah. I was planning on putting my cell phone down. Now I'm going back to do that. It is not just a chosen behavior, but actually a neurobiologic response, because that intermittent reward is actually driving a dopamine surge, which is more alerting, but also going to drive you to have more of an addiction, a desire for that. It is likely that you also are seeing some orexinergic changes there, knowing that orexin, although it is known as being a very significant weight promoting agent in the brain, it also, in its orexin 1 pathway, is one of the main neurotransmitters responsible for addiction behavior. And so this now creates a very vicious cycle. The vicious cycle is, in an adolescent, I have someone who already is more prone to impulsive behavior and poor judgment because I have a less developed frontal lobe and prefrontal cortex, which are a lot of our executive function, our decision making, and our cognitive skills are coming from. When I am now compromising my quality, duration, timing of sleep, that now is further imposing a barrier on the functionality of my frontal lobe, my prefrontal cortex, making me more prone to be impulsive and choose the wrong choices. And now that is going to become a feed-forward mechanism that is going to further compromise night after night, me choosing the wrong thing rather than choosing good quality sleep to help me have my best day the next day.
That's why you working so hard on the TikTok and other things. My last question to you, please tell us about your work, what you do on your channel, and also the program for the school kids, what I really want to feature in my article, Wake Up and Learn, and about your book. Like, give us a short overview of the wonderful work you do in the realm of sleep.
Thank you. So in regards to sleep medicine, I really do view sleep as a tool for living optimally. And so with that, I really am passionate about creating opportunities to empower people on their own journeys. Through social media, I'm Damn Good Sleep. It stands for Dr. Amory Morse, and that's right, I put the damn in Damn Good Sleep. Now, with that stated, all of my social media channels are really directed at responding to what people within the community are saying, I have an issue with, I have a question about, how do I live a better life by utilizing sleep as a tool? And so if you have those types of questions, make sure you're hitting me up and I would be happy to respond. Now, outside of the social media, I, again, am very invested beyond the bricks and mortar of a hospital or a healthcare system. I truly view population health happens within the community. And so I'm very passionate about building programs within the community. One of the programs I developed in 2019 and launched in 2020, yes, during the height of COVID, was a program called Wake Up and Learn. This is a school-based sleep education and screening program that is very much directed at a change culture in regards to the perceptions of sleep and how you can utilize sleep as a tool rather than trying to get away with less sleep. We now have been doing this program in a variety of different middle schools and high schools. We've also replicated it in adult learners in the colleges and universities, as well as in the med school and residency. We've even done a replication of this in faculty and have consistently seen that this brings a lot of reward. The most substantial reward we've seen is that in the school district that we've been in the longest, we've seen that, number one, there's a major difference between our 7th and 9th grade sleepers and our 10th and 12th grade sleepers, where that is really a pivotal change where we see sleep falls off the cliff between our 10th and 12th graders. Our 7th and 9th graders are doing pretty well. And in that school district that we've been in several years now, the first year, 64% of students had features of pathologic sleep. In the first year of executing the program, that dropped to 52%. In subsequent years, we saw it drop down to around 45%. This past year, we saw it drop to 38%. I said, what the heck happened? How did we not change school start times? We didn't change any other structure to the school. We provided screeners, which were to be able to say, is there risk or not? So it's empowering the person to identify whether or not they need anything. And then we provide education, but education that was relevant. Why is sleep relevant to academic success? Why is sleep relevant to how I look, what my skin is, what my weight is, athletic performance, you name it, putting the what's in it for me. What we found was that the reason we saw the drop to 38% was because the 10th, 11th, 12th graders that we saw fall off the cliff have now all graduated. Our current seniors are those 9th graders. What we've demonstrated is preventative strategies work. When you are able to maintain good, healthy habits and be able to say, these are the things that you're in full control of, you make a difference. And so this is a reason I developed that program, is so that we can empower people in the things that we have control over, rather than feeling that we're a victim of whatever our surroundings are, being able to augment emotional intelligence so that they can thrive, not just survive. And so this is a really important effort. We now have replicated it in our clinical enterprise as well as through our health plan, through the Sleep to Be Well program. And it really is something where I believe in putting the power to the patient, which is also reflected in my book that will be coming out next year with Forbes as my publisher. And this is communication in healthcare, charting the course to better outcomes with trust, respect, and teamwork. I truly believe that as an HCP, I'm not a healthcare provider, I'm not a healthcare professional, I am a healthcare partner. And I'm partnering with people who are on their journey to the best version of who they can be. And I need to understand their expertise in their own lived life for me to be able to provide them the benefit of what I've been trained to do and utilize my skills with their skills of them knowing themselves much better than I ever will, because they live in their own shoes every single day.
No, I love it. Thank you very much, Doctor. We really appreciate your expertise, and I highly recommend to my audience to find you on Instagram or TikTok, or just go on your website, Down Good Sleep, with a lot of resources. So thank you very much.
Thank you.